Would love to invite Mr. Ahmed for his own presentation. And this is an awesome presentation I've been waiting for. Welcome, sir. You can have it.
Thank you, Success, for introducing me. Have a good day to everyone. Thank you for having me. I'm Tanvir Ahmed, an urban planner from Bangladesh, and it's a pleasure to join this important discussion. Let me go to my slide first. To let me know if I'm audible or not. Okay, today I'll be sharing insights on how urban resilience, climate change, and planning intersect with our public health, especially for the vulnerable communities in our rapidly growing cities or rural areas, which are expanding towards the urban areas. So, when we are talking about the public health outcomes are not just influenced by the medical care, but by the spaces we live in, the air we breathe, and the climate condition we face daily. The medical actually comes at the very last stage. It's like we can't give the proper solution to public health. If we can give the proper solution to health, then there won't be any medical emergency issues, right? So there comes the most critical issue which I would like to you guys to focus on. That's the spatial inequality. By spatial inequality, actually I'm referring to the urban and rural area. If you're living in a mega city or city area, you always see there are high-tech hospitals or more facilities than the marginalized communities or rural areas. So there is a great spatial inequality situation in every country, almost every country. Most of the countries from the Asian and South Asian and the African, we see there are a lot of spatial inequalities. Like the urban areas have the topmost or high-tech medical facilities, whereas the rural areas always lags behind. So there comes the actual problem. How can we properly plan that? And then urban planning can align with the public health goals, and it can give as the place where we can focus on urban planning or climate risk assessment and address the critical connections also by integrating the special thinking with health, like where we will focus, which part of the area will be more will need the facilities of public health is utmost important, and we can better protect our communities, especially the marginal ones, is our focus of this discussion. So whenever we are going to the discussion of the public health or climate change, our focus has to be remain on what are the issues actually we're facing. The key issues are like urban areas always under pressure of rapid urbanization, but we are urbanizing, we are becoming a mega city. But is there an adequate infrastructure for that? It's like that. Are there open space to breathe? Am I getting the proper sunlight? If a child can't get the sunlight, we know that due to lack of the vitamin D, he will eventually suffer from many diseases also. So it is the area is rapidly urbanizing, but are there actually the adequate infrastructure we are providing for our children's? And then the issues always comes like climate induced heat waves. Heat situation is like a common phenomena right now. We always are discussing a 1 degree or zero point 0.1 degree or point something of degree increase of temperature, how it will eventually affect on precipitation pattern, drought, and other climatic situations. So heat or temperatures is becoming a common phenomena which we have to be also our focus when we're discussing on the public health. And the waterborne diseases from the flash floods. If you see my first slide, it's a slide from the flood sea or waterlogging situation. So there are a lot of issues from the waterborne diseases. So how can we actually prevent the flash flood situation, or how can we make the public resilience to the what flash floods on other climatic is a discussion we should have when we're having a discussion of public health. and also the unequal access to services. As I told, that riches can go move to the mega city or can go to the high tech facility medical care, but the people living in the marginalized community, people living in the informal settlements, are they able to go to the those hospitals? Uh, uh, and again, we have to think that can they get the proper medical facility, the basic medical facility? So there are a lot of case studies shows that the rural area always lagging behind. There are no mobile medical facility also for them. So it's a key issue we have to always keep in mind when we are thinking about the challenges in the changing climate. So there comes the role of urban planning in public health. Like we are talking about public health, medical practitioners, but how can we improve the resilience of people when we're talking about the health? We can integrate planning where that's improve the housing, that's improve the water, sanitation, and hygiene. That's in short form is called WASH. And we how can we improve the green space and the mobility also? Because think like a situation where there is an earthquake, there is no safe exit for the informal settlements. Or there are some mega cities also. Recently, we have seen in Thailand and Myanmar, there's a severe earthquake, but they're telling that in their countries there are no proven record of earthquake. So there are a lot of buildings who doesn't have the safe exit due to the situation of earthquake, and there are a lot of havocs and deaths also because of the earthquake. No mobility for the people to move to the safe exit. So we have to focus on those things, that how can we integrate how proper housing, sanitation issues, and green space and mobility into a proper planning. And zoning is a key issue. If you think about the marginalized population always resides near the industry because they want to accommodate less, and that they want to also invest more in their uh, daily accommodation expenditures and the travel cost. They don't want to live in the city center, right? In the city centers are for the rich people. The marginalized population or the low income communities always resides by the industrial area. And what happens there, the industrial waste also affects them. In my practical situation, I saw a low income community who's been using for years the medical waste water of a medical facility. So they are purifying by localized method. It's not fully purified, but they are believing that it's still purified. The medical waste from a medical facility coming to that low income community, and they're just using some localized method, and they're using those water. So is that water safe? Will we use we if we are in that situation, will we use that water? So it's a big question we have to focus on. So zoning is a critical issue. We have to separate also the pollution sources from homes and schools. Industry has to be far located from homes and school, and how can we do that is a big question, is a big discussion also. But we can also say that we can give incentives to the people of all the to the industry to locate in a zone. Like see thing like a situation, there are A zone and B zone. If you propose your industry in a zone, then you will receive an incentive from the government. So we can think like this situation also. And there comes also the mixed use planning, as I discussed earlier. Is my children getting the proper light, proper sunlight, or the open space to play in the mega cities? So these are the issues which can eventually make us resilient to the climate change issues. Now comes an important issue that we are discussing, that how GIS and remote sensing for health risk mapping. It's like that in the previous presentation, you also see a map. So I can say that that map is also a product of GIS. GIS stands for the Geographic Information System. So it can help us identify where are the vulnerable areas. We don't want to give the mega city which already have the high tech medical facility. So we don't want to create another medical facility there. We want to create medical facility in rural areas or which areas are in vulnerable condition. So our so which can facilitate us in that decision. There comes the GIS and remote sensing. It can give us the heat risk map, which areas are on the heat risk zone, the flood prone areas, or the proximity analysis to healthcare. I'll show you some open source maps from the Google, which can eventually help you understand the issues also. So if we go to this section, this is a temperature forecast map. You can see the forecast of 12 April. This is the worldwide situation. Right now I'm in Bangladesh, so this is the situation of Bangladesh for 12 April. And if we zoom out, then we can see the overall situation. We can see that Mali, Niger, Ivory Coast, Nigeria, these areas are facing an extreme heat wave situation in 12 April. So these are actually the products of GIS and remote sensing. This can facilitate us that which area actually requires more attention. It's like you are seeing overall Mali is facing extreme heat wave, but which area of Mali is facing more heat wave? So if we go more zoom in, we can see more detailed color mapping, which area needs more attention. Like from this area needs more attention because its color is more dark. So the GIS and remote sensing here plays a key role to identify the which location you want to focus first on. Then if we go to the proximity of to healthcare, if you see this slide, this is an area of American and Canada side. So we see that a legend here, proximity to healthcare, low, medium, and high. What this illustrates? This illustrates that these zones are low proximity to healthcare. Like it can be in walkable distance, or where I can just take a bike or to go to my healthcare. But those are in high. It's like that very near, very far from the, my home or my seat center. It's like the look at here. This is a high. So the high means that my healthcare facility is located very far from my home or my residence. So it will eventually cost me to take a more time. So the we can see the from these maps and make a decision. So what our public health requires, like we should make another public health facility here. So these are decisions which can our GIS and data science can help us. If we go to the next slide, then there is our nature-based solution. This is a critical thing that we have to focus on right now. That nature-based solutions like green roofs. And urban forest or wetland restorations can help mitigate the heat and improve the air quality. The incorporating the lived experience with more equitable outcomes also. Like as I earlier said, that we don't want to make a mega city in a low income community. We want to make the low income community more resilient to them. So here comes the nature based solution. As we discussed, the community mapping is also an issue. The community maps where it needs the more focus to develop. And the interdisciplinary collaboration is a very rare issue that we are actually need. Uh, like environment scientists, they are doing their jobs. Urban planners, they are doing their jobs. Health professionals, they are doing their jobs. Or data analysts, they are doing their jobs. But the key thing is that we have to um, make all the people came under a single umbrella. If we are under a single umbrella, we can find everyone insights and we can work together for a better world. And share frameworks and data platforms enhance the coordinate response. As you see the open source platform, I can know the situation in Nigeria from sitting here from my own country, and I can plan what are the proposals to do there. But to be an effective plan, I have to incorporate with the local people. I have to talk with the community people. So these areas have to be addressed. And the key takeaways from this is that urban environment is a key to a public health, is in the central position, and the planning tools and spatial analysis can help us for the intervention. The zoning of planning tools or the spatial analysis we're talking is always the necessary when we are talking. And the inclusion of local voice is essential for equitable resilience. It's like that I'm talking about equity, resilience, and all the things here, but I'm not in a decision making process. So eventually my lecture or my views are neglected. So we have to be a leader to be in the decision making process. We have to be in a situation where our voices matters, so we have to be advocate for that also. And the cross sector collaboration, as I earlier said, that urban planners, environmental scientists, medical practitioners, health professionals, nurse, and all other professionals related to public health, even the climatologist, meteorologist, uh, this can maximize our impact. So my call to action is that public health is everyone's responsibility. This is the basic need of a human. So let's move beyond our silos and engage with all. It's not about just planners, communities, or medical practitioners. It's about all of us. So thank you, and you can find more information about myself from my website and my LinkedIn. Uh, Thank you for the presentation, hearing. I look forward to hearing from you all.